Logo and text, 3M. Science. Applied to life. 3M Ranger Blood/Fluid Warming Unit, Model 245 with the 3M Ranger Blood/Fluid Warming High Flow Set 24355. Clinical application training. An image of the unit.
This video is intended only as an overview of the instructions and procedures required to operate the 3M Ranger Blood Fluid Warming Unit, Model 245, with the 3M Ranger Blood Fluid Warming High Flow Set 24355. This video is intended for clinicians. Prior to use of the 3M Ranger Blood Fluid Warming Unit, Model 245, with the 3M Ranger Blood Fluid Warming High Flow Set 24355, consult detailed product indications, limitations, safety information, and instructions contained in the instructions for use supplied with each product. The 3M Ranger Blood Fluid Warming System is intended to warm blood products, and liquids.
Each component is shown in a graphic and circled as it is spoken.
The components of the Blood Fluid Warming High Flow Set include bag spikes, lure connections, drip chamber with filter, roller clamp, blue inlet pinch clamp, fluid warming cassette, auto venting bubble trap, white outlet pinch clamp, roller clamp, injection port, white outlet clamp, patient connection, and bubble trap holder. To begin use of the blood fluid warming unit, adjust the warming unit height to the patient level or lower to help prevent the risk of air embolism. After securely mounting the warming unit, plug the power cord into a grounded outlet. Open the warming set pouch where indicated by the arrows. Before priming, slide the fluid warming cassette into the slot in the warming unit. Place the auto-venting bubble trap into the holder on the warming unit. The auto-venting bubble trap is designed to continuously vent air from the patient line. Monitor the fluid lines to ensure that they are air-free. Tighten the lure connections. To reduce the risk of leaking and loss of therapy, ensure that all lure connections are securely tightened prior to priming. Close the clamp below the auto-venting bubble trap. Close the two clamps below the spikes. Insert the spikes into the IV bag ports.
Process is demonstrated.
Open the clamp. Invert the drip chamber and fill to 2/3 full, and then turn upright. Allow the auto-venting bubble trap to fill. Flow will stop when the chamber is properly filled. If necessary, gently tap the auto-venting bubble trap against the warming unit to expel any trapped air. Open the clamps below the auto-venting bubble trap and continue to prime the patient line. When priming is complete, close any clamp to stop the fluid flowing. Attach the patient end of the tubing to an extension set if needed and prime. Connect the primed tubing to the patient. Turn the warming unit on. On startup, the unit reaches its normal operating set point of 41 degrees Celsius in less than 2 minutes. The LED display located on the front of the unit displays the warming unit temperature. The temperature of warmed blood and fluids is verified with sensors that check heating plates 4 times per second. To reduce the risk of leaking and loss of therapy, do not exceed 300 millimeters of mercury pressure. Ensure inline hand pressure pumps and other pumps do not exceed 300 millimeters of mercury pressure. Do not remove the warming set from warming unit while in use.
Text, removing the disposable set.
Close the inlet clamp proximal to the fluid warming cassette and open all clamps distal to the cassette. Allow the fluid to flow into the patient for about 2 or 3 seconds and close the outlet clamp. Remove the fluid warming cassette from the warming unit and discard according to institutional protocol.
Instructions for use and safety.
As with any device, it is important to read and understand the detailed instructions for use and safety information. This device is restricted to sale by or on order of a licensed healthcare professional. If you have product questions, please contact your local 3M representative. Call the 3M Healthcare Customer Helpline at 800-228-3957 or visit our website. 3M offers device training upon request.
Logo and text, 3M. Science. Applied to life. Copyright 3M, 2021. All rights reserved. 3M and the other marks shown are marks and are registered marks. Unauthorized use prohibited.